Hey, what's going on, good people? It's your boy James Harris, of course, Mental Heal. Listen, I appreciate all the support over the years, whether it was for my book, man, Just Express Yourself, which is an interactive planning guide for boys and men to better express themselves. So salute to those parents who got it for their young sons. Praises to those partners and couples who got it for the men in their life. Of course, to the schools, the administrative, and everybody else who ordering the book by the dozens. I definitely appreciate that. And also salute to everybody who supported me on Cheesy Date Board Games, which is a good game for adults and couples, your game night, your date night. So many interactive ideas come from it. I definitely love the responses that it's garnering. But now I'm asking for your support again on this YouTube journey. I'm back. I took a little break because I had so much going on, but be a little bit more consistent with it. I got a couple interviews lined up with prominent people and people doing phenomenal things within the community or within this mental health space or even different authors and things like that. So bear with me. Appreciate your support. So make sure you like, share, and subscribe. And the guest that I got coming up now is.
My name is Chip Anderson. I'm from Richmond, Virginia, more or less. My father and my mother were from Richmond. My dad's from Richmond. My mom's from Petersburg. They met at Virginia State. So I was born at Fort Campbell. My dad was military, and then my father. My origin. And I always say, I'm a Gemini. I have kind of two paths here in my world. I was born at Fort Campbell. My dad was in the military. He was served in Germany. Went over to Germany when I was a youngster, and came back. He decided to go. He wanted to go to dental school. As a young African American, he thought he was a biology major at Virginia State, and he got out of the military and went to dental school at MCV at the time. And then he went back in the military because he liked the military service, and he went down to Fort Bragg. So I traveled around a bit when I was a kid, and then he got out again and came back to Richmond, and he went to MCV's orthodontic department, and he was the first African American to finish the orthodontic residency. He was the third Black to finish the dental school in 1970. So he's kind of almost a trailblazer to some extent. So now I lived in that world of military and dentistry as a youngster, and I always was leaning more towards the military side of in my early days. I ended up going to Benedictine for 2 years because I was interested in the military, and I got an ROTC scholarship to Hampton Institute at the time, and then Hampton University. I went there on an ROTC scholarship. I then myself went into the military and did 4.5 years active duty. And somewhere along the line, I said, this was, I had worked with my father, and when I was a youngster, he had me working with him in the summer times and after schools. And I did enjoy orthodontics and helping him out. I didn't really take to dentistry, general dentistry per se, but I liked orthodontics. I had braces myself when I was a kid a couple of times, and so I always, understood orthodontics a little bit. But I thought somewhere along the line, a light switch came on and said, if I apply myself, I think I can go to dental school, and orthodontic school was my goal. I had, I'm a goal setter, and I set a goal for orthodontics. I said, where will I be in the military? I'll be a major. I was a Signal Corps officer, a communications officer. I just made captain, and I said, where will I be? I'll be a major, and I'll have 10 more years to serve in the military to get 20 years for retirement. Or I can be orthodontist in 7 years. I was a computer science major, so I had to take prerequisites. So I had to kind of plan this out. It was not a quick decision and was not made in haste. But I thought that it would be unique to some degree to have the ability to come back and work with my father, to learn from him, and to have, I won't say be handed down the practice because he did sell it to me. I did pay for it over time, but to learn and have a family business, African American family business professional being handed down, and keep the tradition going. So I thought that was something that was different and appealed to me at the time, and I'm glad I made the decision. The military was good. I enjoyed it. I did go back in the reserves in the dental corps later on after my residency. So I went to VCU for dental school as well, and I finished in 1995, and then went to the University of Louisville in Kentucky, back to my roots again, more or less, home state, and did my residency, orthodontic residency there, and then came back to Richmond in 1997 and started working with my father. And he retired in 2012, and I took over the practice and renamed it, rebranded it Anderson Orthodontics. And I've been doing this for 28 years now. It's been a while. So I'm a seasoned and senior doctor, orthodontist. I did do got a master's in oral health at Louisville as well. So I got a DDS and an MS. But at the end of the day, I try to treat patients. I always say I don't have I have a different mindset. I think by being a military person first and foremost initially, and that I think set my tone as being different than the traditional dentist that goes through dental school and has no other experiences in life.
Got you, man. Appreciate that. And
So a long story to get say I've been I've been
yeah,
doing a
no,
lot.
it's all good, man. First and foremost, of course, thank you for your service because, I too am a veteran and I definitely
Sure.
appreciate you and sacrifices that you have to make to at least get there. And not only that is to be an officer,
Yes.
So that,
Yes.
that takes a lot of discipline and hard work. So I definitely appreciate you doing that. So we first crossed paths, of course, because you were my orthodontist. I had,
Well, that was a few years ago, but yeah, I
yeah, yeah.
remember those days. I mean, I remember you talking to me and saying, "Hey, doc, I'm interested in some stuff." So,
Yeah, I had some
so
crowding, and now
yes,
I don't have that anymore. I was fortunate enough to do braces for maybe 18 months or so.
I think that was around that.
So yeah, I'm fortunate that everything worked out what it needs to do. But you educated me on a lot of different stuff with the oral hygiene aspect of it. So that's pretty much why I got you here today
Sure.
because a lot of people aren't educated on it. I just thought, hey, I got crowding, doesn't matter. I smile in people's face. I wasn't really insecure or self conscious about,
Right.
bad teeth, but it's more than just a presentation of it, because of course, like doing my personal studies, I realized that the plaque buildup can cause heart disease and so many other things. So can we talk a little bit about that? What is oral hygiene realistically?
Sure. Well, again, the oral cavity is kind of the window to the heart and soul, so to speak. Because everything goes in your mouth, and it goes throughout the system. So it starts there. And if your oral health is poor, oftentimes, there are other health related issues that contribute. The oral health contributes to other things. So if you have those types of things that can lead to diabetic issues and contribute to things. There are certainly heart related issues. There are plaques and bacteria that can be leached off into your system and can contribute to heart issues. So it's a lot of things involved. It's not necessarily one thing per se, but your overall oral health. If you have good oral health, oftentimes you have good general health. If you have poor oral health, you will often have other health related issues. And one of the things I always wanted to say, James, especially in your health, in your field, being mental health, which is certainly much more prevalent in today's society than it was, when I was coming up as a kid,
Yeah.
and in the past, my parents' era and things like that, is psychosocial aspect. I mean, there's a lot involved in orthodontia especially, but in dentistry in general, as far as the psychological, how you feel about yourself, your self-worth, and if your occlusion or your bite is off or things are crowded or spacing or whatever. I was teased as a kid, about bucktooth and things like that. And I look back, I kind of shrugged it off, but again, I didn't really know. I came from Germany as a little kid, and spoke German, so as much as English. So there's things that you don't know from when you're coming from different cultures and different things, and that can play a factor. But I really look at mental health. I can't tell you how many patients I've talked to at the end of their treatment, and they say how much their lives have changed because their smile is better and their occlusion is better, their teeth are straighter, and how they feel, how much they feel about themselves. So, I really want, while oral health is a big part, and I want to kind of hone in on the mental health side of it because that's your field, and I
Yeah.
know that is something that is not spoken of often, but there's psychosocial things that it can be really, I don't say devastating because you don't know it. You don't know how people take things.
Yeah.
And
The confidence and all that too.
yeah, confidence is so tenuous in a young age, in teenagers and young folks. And people are missing teeth or congenitally missing teeth. There's all kinds of ways that dentistry and orthodontics can help and get people back to better, healthier occlusions. And that's just priceless to some extent, because you can't put a price on your mental health sometimes and overall health. I mean, richest person in the world can't buy his way into a good health or her health. So, and same things with the mental health. So I really think that it's a linchpin to just overall well-being. And that's something that, can't be quantified always. And you don't, that's not one thing that you think about on a daily basis or when patients come into your office, but that's certainly something that I always ask about, how do you feel about your self-esteem? Is there something, and sometimes, people have overbites or thumb habits and things like that. I've got people, I remember one young lady, she was, uh, in college and she was still sucking her thumb. I was like, we need to stop this because she was in ROTC and she had one military. I said, we need to stop this before you get in the military. It can't be a lieutenant sucking your thumb. So, that is, just, it's not every day that I think about it, but, when you get a patient that says, hey, this changed my life, that kind of resonates with you and just lets you know that, hey, I'm doing something that's good and it's not, it is recognized by some folks.
So for the people who feel that they don't have insurance or they can't afford to, get yearly oral exams or any other type of exam
Sure.
or even braces, what do you suggest? Like, what are some other ways that they can, I guess, enhance their oral
Well,
presentation?
certainly, brushing your teeth, twice, at least twice a day. I always tell patients, you need to brush if you're going to brush twice a day, or usually you should brush 3 times a day or after each meal, but you need to brush at nighttime before you go to bed because literally you're feeding the plaque. The plaque is is going to feed the bacteria, and if you think about it, you're sleeping 6 to 8 hours or more or less, but that is you're letting the bacteria have a party in your mouth every night overnight, and after a while it can cause periodontal disease, which is bone loss and gum recession and things like that, and inflammation, poor, again, that plaque, and that plaque becomes hardened, becomes calculus, which is then you can't get it off physically yourself because if you leave it there long enough, it literally hardens and becomes calculus, and then you need a dentist or hygienist to get that off. And that's so early education and early addressing kids' needs, children's needs at an early age, and introduce your child to the pediatric dentist at an early age. That way, they don't have to get this phobia of dentistry, and it becomes a positive as far as opposed to a negative. So there are lots of great, pediatrics in the area. And, some of them are fraternity brothers. And, so Dr. Randy Adams is a great pediodontist, has been doing this for years and years. And, he's one of the premium ones in the area. And so at the end of the day, starting early and then continuing throughout your life, again, oral health should be, you should see a dentist twice a year for hygiene visits, ideally, and more if need be. Sometimes we get hung up on what the insurance company says. Oh, I can only come twice a year. I can only do 2 visits. No, you can do more if you need to. And you may have to pay $100 or $200 more to get that extra cleaning in there. But
Yeah.
you know what? We pay that that Comcast bill and we get those new shoes that you got in the background. You've got to, sometimes we have to make a decision that's for ourselves and take care of ourselves. As parents, we have to take care of ourselves. Because if you can't take care of yourself, how are you going to take care of your children, your family? So you've got to sometimes be a little selfish and take care of yourself. We usually put ourselves at the back, especially if you've got children and things like that. So, but sometimes you have to, be selfish to take care of yourself. And sometimes you would do that at a later age and stage, and that's okay too. But, our oldest patient was 87. So from basically 7 years old, in the orthodontic world, I like to see patients around 7 or so at the earliest. And sometimes you're not going to do early treatment, but I always want to make sure there's nothing going on that can be addressed with either minimal things, habit appliances, or maybe it's taking out some primary teeth, some baby teeth to manage things, or you're just going to monitor kids and make sure the parents and the patients are being evaluated. And if you see something that's going on, and you can address it and catch it before it becomes a major problem. Major problems cost more to fix, take longer time to fix, and often are more complicated. So it's just if you do things in a smart fashion and get preventive medicine is good medicine. Preventive dentistry is good dentistry. Every day you wait, the cavities don't get better. They get worse, they get bigger, they get more expensive. A cavity becomes a root canal, becomes a crown, becomes an extraction, becomes just more, more of everything. If you lose a tooth, what do you need? You need an implant or a bridge. Well, both of those things are more expensive than the cavity would have been taken care of. So, it's often, more cost efficient to do things in an early time, and you can take care of things and make sure it doesn't become a more significant problem. So at the end of the day, that's what save $1, to save 10. Yeah, but if you don't wait, it's going to cost you a lot more in the end to fix it or get it better. So dentistry is affordable. It's not. It hasn't. Orthodontics has not gone up like the cost of cars. I mean, I remember back in the old days, dentistry, orthodontics was cost $3,000 or $4,000. Well, now it's $6,000. Well, cars used to cost $3,000. Now they're $50,000. So I mean, just the cost of living on what we prize and what we do in this society is we value some things and we don't sometimes value our health, our oral health. Again, you can't really buy, fixing problems sometimes.
So, what would you say for the parent out there who has a 7 or 8 year old who like what are some things that the parent can recognize or suggest that
Sure.
they'll eat or whatever so they wouldn't have the cavities or need fillings? Because I've seen some younger people with
Yes.
silver in the back
Right.
or
Again, that's where the baby bottle caries. You heard of, well, you may not have heard baby bottle caries, but baby bottle caries is when a parent gives a child milk and sugary things, juices at nighttime, and they're literally feeding the bacteria that becomes, they're not brushing the teeth off and brushing things away and keeping things healthy and clean, and that becomes cavities early. And then you see these children with stainless crowns, and because they can't be restored. So again, it's penny wise, pound foolish. You're trying to put a kid to sleep, but you're causing the kid pain sometimes, and you're not aware of that. And so little things like that are problematic. Now you've got habits. 7. You want to stop sucking thumbs by 7 or 8 because it becomes speech issues. Again, it's not just about dentistry and not just about, it's about speech patterns and talking without got a little model here. If you've got an open bite and your tongue, let's see if I can get this model to work. This is not my normal model. I have this old model from dental school. But if you have an open bite where your teeth are literally not touching in the front, well, guess what? Your tongue literally goes there, and now you have a tongue thrust, and tongue there, and your th and your s's and your things are not properly pronunciated or enunciated, and so those are things again. goes back to your psychosocial aspects as well, because now the kid, your parents, your teachers can't understand you, your friends can't understand you. Little things like that build up on things that cause future problems and mental problems, mental health problems sometimes as well. So I think you certainly should see a pediatric dentist early in life, between ages, I'd say 1 year old and 3 years old at the latest. But and probably pediatric dentists will probably want you to see a little bit earlier. But again, it's just to get them into the office, and you're not really doing much, but you're checking them, make sure there's no cavities, and again, educating the patient and the parents to make sure that they are doing the right things and not feeding the kids the juices and things like that at nighttime just to get them to sleep.
So let me ask you this: is there any disadvantage to one not getting spacing or gap closed up? Because you look at, like, let's say Michael Strahan, he got
Sure.
millions of dollars. He can
Well,
pay to get his gap closed, but
yes. Well,
you, so if he was
Strahan
your client, what would you advise him?
well, I would have gotten Strahan about 30 years ago. We would have closed that gap, but it's his trademark now. So
Yeah,
some things become their linchpin and their kind of trademark. So some things, when you have spacing and diastemas and what you're talking about, it causes, as if the teeth are spaced apart. Well, as the permanent teeth come in, well, permanent teeth are bigger than baby teeth, so you're going to get some transitions where you may need that space to be consolidated instead of being spaced apart. It can consolidate the space so that the permanent teeth that are left to come in are coming in properly and not being impacted or causing other issues. So there's a myriad of reasons to get checked out again early. Again, I like to say patients between 7 and 10, because again, I'm always trying to avoid a problem. I can't tell you how many times I have had some primary teeth removed to influence the eruption of a poorly positioned canine more often than not, permanent the canines, and have a couple of baby teeth taken out. Well, guess what? The permanent teeth comes in a much better on its own after this has been done, versus letting that tooth just come in because the doctor or someone says, "Hey, you shouldn't go see the orthodontist until all the teeth are in." Well, the teeth aren't going to come in because there's an impaction, and that tooth is stuck now, and it's behind the permanent teeth, and it's impacted in the roof of the mouth, and it's never going to come in, or it can cause damage. I've had cases where literally a canine has eaten the roots on the lateral incisor of other teeth, so it can literally damage other teeth. So you're causing problems just by avoiding a simple visit to an orthodontist, get an X-ray, a panoramic view, which shows where the teeth are, how they're coming in, the eruption positions, the eruption patterns, and then let that doctor assess things and see what needs to be done, if anything. If nothing else, you come back on a recall, see them periodically every year or so, sometimes more frequently, but usually I'm seeing 7, 8, 9-year-old once a year, and just kind of monitor things, make sure that they're not having issues that come up that can be addressed and avoided.
got you. So I was in a position to get traditional braces,
Yes,
train tracks, metal mouth, whatever you
yes,
want to call them.
yes.
But
We've
I know
got
now you see the commercials with they
yes,
nail you to Invisalign, and I know you got your version
yes.
of. So is there any difference between traditional braces and the ones that you just put
The
in
aligners,
over
sure.
time? The aligners?
Well, nowadays, everybody's heard of Invisalign and the aligners, clear aligners. There are lots of brands out there now. We use Invisalign, as well as another company called Angel Line, was what one we're using a lot now. I'm having real good success with. Just for cost savings, a lot of times I can pass on some cost savings. We have our own in-house product where we do some minor cases now, called A plus aligners, where we have the technology nowadays is just so much different, James, than when I had braces. Or we don't take any impressions anymore. We're doing digital scanning. We have 3D printers, so we can print the models of your teeth, how they are. We have the ability to print and fabricate the aligners in-house, or again have companies out there that are doing them. So those things allow you to eat what you want to eat. Your dietary restrictions are much less. Your hygiene is going to be really good. It can be faster treatment sometimes. But the main thing with that is patient compliance. You've got to be wearing them. You've got to be really diligent and wear them. You usually wear them 18 hours a day, or thereabouts, or a little more. 18 to 22 is optimal. I'm an 18 to 20 hour day guy. I'm a practical. I'll say I'm practical. I want to give patients some freedom to enjoy life a little bit without, if you've got a meeting or something like that, or going to the movies, enjoy yourself, take your liners out and eat, do what you want to eat, do, brush your teeth, put them back in, and keep moving. So it's a great thing for adult patients. I mean, certainly patients who've had braces before, we got a lot of, retreat cases, whether they've had them, 20 or 30 years ago, and they lost their retainers and they didn't wear them, and things shifted, and then they have kids and they're going to take care of the kids. And now it's, their kids are older or whatever, and they're done, and they can take care of themselves again now. So we have a lot of adult patients who do aligner therapy now. And it's really good. I like it a lot. It's a different methodology, but at the end of the day, you still want the same good results versus traditional braces or ceramic braces. We have different methods. We have gold braces for those who want jewelry effects. I mean, there's ways, of getting, the aesthetics. Sometimes you get the kids like, oh, I want the braces because I want the colors, and they change the colors out periodically every time you come in. So, we give them that option. Again, we talk to the parents, and even nowadays that you have the ability to have children with aligners. They have aligner therapy for children as well as teens. Again, they try to expand the market and do more things with them. But at the end of the day, compliance is a big part of that, and you've got to be compliant. As an adult, I always say, adult, you can throw your money away. I don't want the kids to throw mom and dad's money away. So you want to make sure that the patient and the parents are aware of those types of things, and have successful, treatment outcomes.
See, for me, I don't, I'm a disciplined person, but I feel that I had to have gotten the traditional braces
Sure,
because the
sure.
Invisalign, I'm just on the go so much, and
Yeah, again,
I've
some
been
people
left it, and
you drink a lot of coffee drinkers. So there's a different. Again, you've got to know yourself, know thyself, and to get
yeah.
the right results at the end of the day. That's what. Again, I will say I don't care how you get there. Get there if you can. That's an old song by Miss Adams. You know, train, planes, automobiles. How we get there? Whether it's traditional braces, aesthetic braces, gold braces, aligner therapy. Any way we get there, we want to get good results that are stable and functional, and can give you good aesthetics and functionality.
So, what are some ways that people can pay for braces and or exams? So, I know
Sure,
you have
sure.
the traditional insurances, Medicaid,
Right.
Medicare. You probably even take FSA or HSA.
Yes, exactly.
What are some options? Okay.
Sure. So let's start with the traditional insurance. Traditional insurances usually pay a percentage, or a certain set amount. There are different variety. I would say there's some plans that have set fees that will pay towards your care. Some plans have a set fee that they pay nothing, but they've negotiated the rate with the doctors, and they get you cost savings on that. And there's some that just will pay towards it and pay a certain amount towards that, whatever, dental care. Um, and again, these days, there are a variety of different insurance companies out there. You've got, whether it's your business or your, over the open market. Most plans will have some type of orthodontic care. Usually X for a lifetime. It's not, you get some now and get some later. It's usually once in a lifetime. So if you have a plan, 10 years ago and you had braces 10 years ago, if you have the same plan, you may not have any benefits remaining on that. Where that's different from dentistry, where it refreshes annually, every January or every fiscal year, whenever the plan rolls over, you get a refresher on that policy and benefits. As far as orthodontics is concerned, we have payment plans oftentimes, where it's a down payment and or monthly payments. There's outside servicing companies that can pay. They can spread things out. There's a lot of different ways, and we try to make it affordable. And again, it's not necessarily inexpensive, but it's affordable. And again, you have to kind of value what the services are. There are some companies out there that do it yourself. I mean, there's the do it yourself aligners, and there was a company out there called Smile Direct Club, and they went bankrupt because it wasn't as successful or as easy as. It's not easy to move teeth around all the time, and people think it's easy. It's not. I mean, I went to school for a long time to learn this, and I have a lot of experience doing it. And but I'm always learning things. I mean, every day I want to learn something because that kind of keeps it fresh. You know, the new patient that comes in that has, you know, certain type of malocclusion that, you know, you haven't seen for a long time or haven't seen in a while, and it kind of brings you back, and you got to rethink about how you're going to get that, and how you're going to treat it, and how you're going to address it. And sometimes you need additional help. You need other doctors. Dr. Barry Griffin was a periodontist we used all the time, and he would expose teeth, and oral surgeons, Dr. Harrison, Dr. Watson, and others in the area, you know, that help us with either extractions or exposures, and even jaw surgery. I mean, excuse me, I have we have what we call orthodontic surgery, where jaws are out of alignment. You have significant underbites, or, you know, jaws where you can't just fix things simply with a dental problems. There's skeletal problems, and, you know, I can't just do it by myself. So we need coordinated help, and that's something that you know, I had a patient who was an adult. He was in his early 40s, and he had jaw surgery. I mean, it was my oldest surgical case. But so you're not, I won't say never too late, but, you know, you certainly can do things for yourself if you're willing to do it and sacrifice, and go through the, you know, sometimes they're not the simplest things to do to get that, but it's worth it in the long run if you think about the next 30 or 40, 50 years of your health. And we want to improve that lifespan, whatever that might be, and make it as good as we can at the end of the day.
This was a rich discussion. I'm sure people are educated.
Yes.
What is a final tip that you would like to leave people, whether it's, hey, just simply brush your teeth and use mouthwash, or is it something
Yes.
elaborate? But what's a tip that you find that would be helpful for not only the parents of those young people? It can be a stubborn adult who feel like, I'm not smiling in people's face, so I don't care if I got spacing or crowding or
Right.
whatever the case is.
Well, I would say that, you know, it's never too late, and sometimes it's not too early, and it's not too early as well. So, you know, seek out care. I mean, just, you know, it doesn't, we have, you know, free consultations, so it doesn't cost you a thing to walk in our office to get an x-ray. You know, we do free x-rays on the panoramic views, and cephalometric profile views. We do that on the house, because that's not going to cost you a nickel. We're going to be able to look at you and assess you. So it doesn't cost a thing other than time, and your willingness to come into the office. And there are many offices that do that as well. So, you know, and I can't speak to the dentistry about being a free exams per se, but, you know, there are free clinics out there, and if you can't afford things, you know, Medicaid does do orthodontic care, but it's a qualification situation. But Medicaid does pay for general problems for dentistry. You know, fixing major to moderate problems, and but again, the sooner you fix things, it becomes a major problem. It's not a major problem; it becomes a minor problem. So if you ignore it, it's not going to get better, unfortunately. You know, oral health does not get better with negligence, and you know, people can pass from oral infections and things like that. So it's not as something that's insignificant that can't, you know, can cause some significant issues. You also have, you know, oral cancers can be, you know, diagnosed. I mean, so there's lots of things that can be, you know, not only prevented, but, you know, evaluated and checked. And the sooner you fix it, get to a problem, the better. The longer things are ignored, whether it's something minor that becomes major, or again, as significant as oral cancer, that can become more significant and become life-threatening. Um, and, you know, at the end of the day, you've got to take care of yourself as well as your family. So if you're an adult and a parent, you got to take care of your kids, but you got to take care of yourself too. And certainly, you can, you know, bring them in, bring your kids in, and we will be happy to take a look at them, and talk, and whether they're ready or they're not. I'm not an arm twister. You know, I see patients, you know, and 2 or 3 years later they come in, they be ready for treatment. So that's okay. You know, get your finances ready, get yourself mentally ready. Sometimes you get mentally ready for this. You know, there's all kinds of reasons to do it. So at the end of the day, it's not just oral health; it's mental health. It's all kind of combines. And I think, you know, we're here to help, and we make smiles. And that's at the end of the day, I want to make people smile and feel better about themselves. So
Gotcha.
I guess I'm kind of a mental health helper as well.
Yeah, no, all of it, man. Like you said, that psychosocial part, I mean, definitely when you got a good smile, you tend to show it off, make other people smile, and so many other factors
Right.
definitely goes into it. You're a little bit more social too if you're not self-conscious about a gap or overbite or crowding or, cavities and all those things. So yeah, I guess in a sense, you definitely contributing to it. So if somebody definitely wants to come and get a consultation
Sure.
from one of your two locations
Yes,
or
sir.
become a patient, to get preventative treatment or just say, hey, listen, I want to see a difference in my oral presentation. Like,
Sure.
what are ways they can catch up with you?
So, for my practice, as far as I'm concerned, we have two locations: one in Monument Avenue, Central, Midtown of Richmond, and then one in Colonial Heights, which serves Petersburg and Dinwiddie and the Tri-Cities area and Fort Lee. We have military discounts as well. So again, we salute those who serve and give back as much as we can. We have, a website, a+aortho.com, or you can look up Anderson Orthodontics, Dr. Chip Anderson. Um, We've got phone number, area code 804-285-9800, website, we got on Facebook. We've got, we try to be out there. We're not as much on social media as I, I'm an older guy, so I'm not as socially attuned to the social media, but we try and do some things out there. We did a lot more before COVID, but kind of set us back a little bit back in the day. But at the end of the day, we're happy to see you for consultation. VCU Dental School is also outsource source for folks who don't necessarily have as much. They have clinics there, the emergency clinics and things like that. So there's ways around, just getting around all the financial side of it. Medicaid pays for some things. Medicare pays for some things for adults. Not for they don't pay for orthodontics, but again, we have payment plans again for that. So we try and make things affordable and spread things out over a period of time, so it's not a ton of money up front necessarily. And again, we can make it work for you, and we work with people all the time. So we're here to help and make people smile at the end of the day.
Hey, man, I definitely appreciate you with this rich discussion that you was able to participate in. I'm definitely gonna put your information within the description so people can reach out, and we'll go from there. So I definitely appreciate your time, and I
Not
catch
a
you
problem,
next time.
James. My good friend, I appreciate you, my friend.